Okay, so on this picture, when you're doing your studies for gross anatomy of blood vessels, you have anatomical figures like this. Okay, then you have more specific ones that you can zoom in, like this is thoracic cage, some of the vital organs. Okay, just the head and neck area, the circle of Willis, so the brain. All right, you've got these flow charts. Okay, the flow chart version, which we'll talk about that in a minute. Here is a specific extremity. So the upper extremity, there's the lower extremity. Okay, and the same with the veins. Okay, you can look at different areas. Okay, so I'm going to start with this one. All right, so you have the aorta, and here's another view of the aorta. All right, but you have the up part, so the ascending aorta, the aortic arch, and then the descending aorta. Okay, then the thoracic aorta, and then once it pierces the diaphragm, okay, then the aorta turns into the abdominal aorta. Okay, we have three branches off of the aortic arch. Okay, the brachiocephalic, left common carotid, and left subclavian artery. Okay, up here you can see that a little bit, the brachiocephalic, left common carotid, and left subclavian. Okay, subclavian because it goes underneath the clavicle. That's where it gets its name. Okay, as we move down the arm, okay, you have the right subclavian artery, and then the axillary, and then the brachial, which is where you're going to do your blood pressure. You occlude the brachial artery when you're doing your blood pressure measurement, and that's also what you're listening to at the stethoscope. Okay, on the thumb side, that's the radial side, so that's the radial artery. On the pinky side, that's the ulnar bone, so the ulnar artery. All right, so you have the left common carotid artery, and when you see the word common, you know that means it's going to split into, it's going to bifurcate. So it goes from one into two things. Okay, so this would be the common part, and then it splits. Okay, so the left common carotid splits into the internal and external carotid. Okay, as we work our way down, the abdominal aorta eventually splits. Okay, into the common iliac artery. So you do have a right and a left common iliac. There's that word common, so it's going to let you know that there's a split coming up. Okay, so the split is right there, and you have the internal iliac, and the external iliac. Okay, internal iliac, external iliac. And then that will eventually turn into, as you go down, the femoral artery, runs with the femur. And then that will drain into the popliteal artery, which is behind the knee. Okay, and then that popliteal will split to the anterior tibial and the posterior tibial. So there's a blood vessel in the front of the tibia and a blood vessel behind the tibia. Okay, the fibula bone runs to the outside, so that more outside artery is the fibular artery. Okay, and then you have the dorsal pedis, which is also one of the blood vessels you can palpate for pulse reasons. Okay, some more of the blood vessels with the head and neck. So here's a view of the common carotid. Okay, that common carotid will split to the internal and external. So the external is more to the outside, so it's a more superficial blood vessel, and the internal is deeper. Okay, then the branch off of the that goes up into the neck or into the vertebral bones is the vertebral artery. Okay, and they pass through the transverse foramen, which are in the transverse process of your cervical spine. Okay, that goes back to ANP2, looking at when we looked at the blood vessels that go through those holes in bone, right? The transverse foramen have the vertebral artery. The vertebral artery will eventually supply the circle of Willis, which is this. So this is an inferior view of the brain. Okay, you can see the vertebral artery there. And it comes in to feed the basilar artery, which is a major blood vessel that is going to supply blood to the brain. Okay, this is the anterior aspect of the brain, posterior aspect, so the occipital lobe, frontal lobe, just to orient you here. Okay, person's right side and the person's left side of the brain. Inferior view. Okay, that orientation is important because of the names of a bunch of these blood vessels, like the basilar or the basilar artery, will give rise to the posterior cerebral artery. Okay, supplies the posterior aspect of the cerebrum with blood. Okay, then you have this communicating blood vessel. Okay, if you divide the brain in half, you'll have the posterior aspect and the anterior aspect. Okay, you also have the internal carotid artery that supplies more of the front half of the brain. So vertebral artery, more of the back half of the brain, and the internal carotid is going to supply more of the front half of the brain. Okay, then we have this posterior communicating artery that connects basically that front part to the back part. Okay, and the internal carotid. All right, then you can split the brain into right and left as well. Okay, so on the right side, right, you've got the posterior communicating artery, the internal carotid, and then there's this right to left communicating artery called the anterior communicating artery. Okay, and eventually those give rise to the middle cerebral artery. Okay. As far as a stroke is concerned, since we're looking at this picture, with the more distal, the blood clot, the ischemia, so let's say it's right there. Okay, so the more distal, the less damage. Okay, so let's say it was that spot. So that means probably like that area would be damaged. Okay, the more proximal the stroke, like let's say it's right there. Okay, the more proximal, the worse. So if that really was it, okay, right there, look at all of that. That would have been damaged. Okay, so the deeper and the more proximal, the worse the stroke would be.
Dr.
Okay, so
J.
if you, yeah.
Dr. J.
Yes.
So when you say the more distal and the more proximal, are you saying to what? To the frontal part of the brain? Is that what you're referring to when you say the more distal to that or the more proximal to that? Is that what you're referring to?
Now, more so like the middle of the brain, if you could,
okay,
in all directions, kind of visualize the center of the brain.
Okay.
Is a good reference. So the farther away from the center you go, and you have an infarct, then the less damage happens to the person.
Okay.
Okay. So like look at this picture here. So let's pretend like that spot right there was the stroke. Okay, what that means is from that point on, tissue was deprived of oxygen, which means those are the cells that are going to die. That's fairly minimal for your, the stroke family. Now imagine if it was right there. Okay.
Right.
So that's more proximal and deeper, to the center. If that happened, look at all the damage. I mean, that's a huge area.
Wow. Yeah.
Imagine if, well, let's take it a step further. Imagine if it was the basilar artery. So right here. I mean, that's basically the entire brain. At least the entire back half of the brain would be deprived of oxygen. So that would be severe. So same in the heart. When you look at the heart, the more distal, then just a little bit of heart cells die. The more proximal, then a huge area of the heart will die, heart cells.
Thank you for clarifying that. I appreciate it.
Yeah, you're welcome. Okay, then you'd have to go back to your neural mapping or the spatial map of the brain or the different areas that the brain operate, keeping in mind that the right side of the brain goes to the left body and the left side of the brain goes to the right body. So if a person has, let's say, a right arm, somewhat of a paralysis because of a stroke, that means the left brain got hit in the area that operates the arm. Okay, that's your homunculus. All right, and there's obviously varying degrees of strokes, strokes that are minimal enough where you wouldn't even be able to tell, all the way to the other end where strokes are so bad they can kill a person. Okay, all that is called the circle of Willis. Okay, we'll get back to the flow chart in a minute. Okay. So the flow charts are nice because they, the arrows will help with direction of blood flow and kind of an order to it all. Okay, so here's the heart, so the left ventricle. When the left ventricle contracts, it's going to eject blood into the aorta. Okay, the ascending aorta, eventually the aortic arch, and then the descending. Okay, then you've got those three branches off of the aortic arch. Okay, technically the very, very first branch off of the ascending aorta are the coronary arteries. Okay, it's just that the first blood vessel off of the aortic arch is the brachiocephalic. Okay, so when blood is pumped through the ascending aorta through the coronary arteries, that is what actually supplies the heart with blood and nourishment. Okay. All right, this also tells you where the blood supply goes to. So the left subclavian artery eventually is going to supply the upper limb. Okay, down here, from the descending or abdominal aorta, one of the major branches off of that. Now keep in mind, we have now pierced the diaphragm. Okay, so we're now below the diaphragm in the abdominal area. So the celiac trunk is a major blood supply that goes to the spleen, pancreas, stomach, liver, and gallbladder. Okay, so the celiac trunk will split into the splenic artery, the left gastric artery, and the common hepatic artery. Okay, the splenic artery supplies the spleen and the pancreas. The gastric artery supplies the stomach, and the common hepatic artery, so hepatic or HEPA, which is liver, right? So it's going to supply the liver. And the gallbladder is embedded within the liver, so liver and gallbladder. Okay, the superior, as you keep working down the abdominal aorta, get another branch, the superior mesenteric. If you have a superior, that means you have to have an inferior, another directional term with respect to blood vessels. So it's a clue. It's letting you know there's another one. If you have a right, you have to have a left. If you have a superior, you have to have an inferior. If you have a lateral, you have to have a medial. That's why they give it the directional terms. Okay, the superior mesenteric artery supplies your small intestine and the colon. Okay, the ascending colon, which is the up part of the colon, which is your large intestine. Okay, and then the transverse colon. So the colon, which is your large intestine, if you follow the poop pattern, it actually goes up, ascending colon, over, transverse colon, down, descending colon, sigmoid colon, rectum, and then you go number 2. Okay, now we haven't gotten to the gastrointestinal system yet, because once we do, we're going to look in more detail at the large intestine and all that. Okay, but for now, the quick version is the large intestine actually goes up, over, down, and then eventually out. Right, so the superior mesenteric artery supplies the small intestine, and kind of the right and upper half of the large intestine. Okay, I think, as you all know, I'm a big fan of gastrointestinal health, and one of the things that helps with the GI system is lots of blood. Okay, lots of blood needs to get to the stomach and the intestines and all that to help you break down the food and assimilate it and absorb it and all that stuff. Okay, we'll talk about that when we get to the GI system in more detail. That's also why when you're in the sympathetic nervous system or stress, okay, the stress decreases blood flow to your stomach and your small intestine and all that. So it's not a good idea to eat when you're stressed. Okay, the sympathetic nervous system is fight or flight. The parasympathetic nervous system is your rest and digest. That's the nervous system you want to be in. So the celiac trunk and the superior mesenteric artery and all the extensions of the tubes that go with that inevitably supply your GI system, they really like being in the parasympathetic nervous system, rest and digest. Okay. Okay, as you work your way down, okay, you get to the right and left suprarenal arteries, which supply your adrenal glands. Okay, when your adrenals release its things, like epinephrine, norepinephrine from the medulla, and then your mineralocorticoids and cortisol and aldosterone and all that stuff from the adrenal cortex. This is how it travels throughout your bloodstream, right? The arteries and veins come in and out of the adrenal glands, so your right and left suprarenal arteries. Okay, then you have the right and left renal arteries. Okay, renal is a fancy word for kidney, so these are the arteries that are going to supply your right and left kidney. Okay, then the right and left gonadal arteries, which supply the gonads, so in females, the ovaries, and males, the testes. Okay, then the inferior mesenteric artery, which is going to supply the other half of your colon. Okay, so we have the up part, the over part, so ascending, transverse, descending, sigmoid, rectum. Okay, the inferior supplies basically the other half of it. Okay, now we're getting into like the belly button area. And now it's gonna split. You're gonna have the right and left common iliac artery. Okay, there's that word common, which means a fork in the road is coming up, and so that's going to split into the right external and internal artery. If you have a right, you have to have a left. Okay. So then we eventually get into the lower extremity. So then the external iliac artery spills into the femoral artery, which spills into the blood vessel behind the knee, the popliteal artery. And this is something that you can palpate and check for a pulse. Popliteal artery splits into the anterior and posterior tibial. Okay, that anterior tibial will spill into the dorsal pedis, which is another area you can take your pulse or take a pulse. Okay, the veins you have to work toward the heart. Okay, so if you're a red blood cell, what tube are you going to drain into next? Okay, so starting down here, since we're working toward the heart, you have the longest vein in the body, the great saphenous vein. Okay, that's also a vein that they can use to do bypass surgery for the heart. They'll take that vein out. And some people, that vein goes bad, so they cauterize it, basically kind of burn it out and render it ineffective. Okay, if you have a great saphenous vein, then you have to have a small saphenous vein. Okay, the small saphenous vein is on the more lateral side. Okay, and that drains into the popliteal vein. Okay, you also have the posterior and anterior tibial vein. All right, then from popliteal vein, you'll go into the femoral vein. Okay, and that will drain into the external iliac. Okay, you also have your internal iliac vein. And from the external, you'll come into the common iliac veins, and then eventually the inferior vena cava. And that goes all the way to the heart, goes all the way to the right atrium. Okay, so here's the inferior vena cava. And eventually you're going to have the right and left renal veins. Okay, oftentimes filters are put in the inferior vena cava below the renal veins, so you don't have blood clots going into the renal veins or even going up into the lungs or the heart or the brain. Okay, from the inferior vena cava, eventually you'll come to the hepatic portal vein, okay, which is very important because all blood has to be circulated through the liver. And a major source of that in and out route from the liver is that hepatic portal vein. Okay, then eventually the inferior vena cava into the right atrium. All right, working this way, you have the radial and ulnar vein, then the median cubital vein, which is a common site to draw blood from. Okay, on the body side, so the basilic vein and the cephalic vein can be tricky because they run, so the cephalic vein is there, basilic vein is there, but which one's which, right? You can confuse them easy. So just think body or the B and then basilic. So B for body. So the basilic vein in anatomical position is going to be closer to the body. And then the cephalic vein is going to be farther away from the body. Okay, then those will drain into the subclavian. Okay, then eventually the right brachiocephalic, and then the superior vena cava, and then into the right atrium. Okay, now coming down from the head, you've got the internal and external jugular. And those eventually drain into the brachiocephalic vein, which then drains into the superior vena cava and into the right atrium. Okay, now that's going to be an important one clinically as well, meaning the jugulars, because if a person is having like let's say pulmonary hypertension, okay, there's your heart. We divide the heart into 4 chambers. There's your right ventricle, so that's the right atrium. Well, the right ventricle pumps blood to the lungs. Well, if there's something wrong with the lungs, you're going to get backup of blood into the right ventricle, which can then back up the right atrium, which can then back up the superior vena cava, which eventually can back up the jugular vein. So you can look for jugular distension. That's also a sign of healing, is if the jugular vein is distending. As time goes by, you notice it's less and less. And these are things you'll actually monitor and take measurements of and stuff. But it's an indication that the lungs and that right ventricle and the right atrium and all that is starting to improve. Okay, you also have, so the basilic vein drains into the axillary, which eventually drains into the subclavian. Okay, with pulse, these are some common sites to take pulse. The most common, I'd say, would be the radial and the carotid. Okay, but you can also take pulse from the superficial temporal, the facial artery, the axillary artery, the brachial artery, the femoral artery. Okay, that one is important to palpate before you start sticking needles within that groin area. And in general, it's pretty easy to find, a nice bounding pulse, and now you know where not to stick a needle. For whatever reason, you need to go into that area. I go into that groin area quite a bit for dry needling reasons because of all your adductor muscles, right? Your PAG muscles. Okay, the adductor magnus and gracilis and all that. Okay, so if you need to rehabilitate those muscles, then yeah, you just have to be careful not to hit that femoral artery. So you use your knowledge of your anatomy and your palpation skills. And then what you do is you actually physically draw on the patient. So I know exactly where that femoral artery is, and then you just avoid it. Okay, you can palpate the popliteal artery, the dorsal pedis, and the posterior tibial artery. Okay,